Hello everyone, I am Rahul Goel. I am an assistant professor at Transportation Research and Injury Prevention Center, and it is based at IIT Delhi in New Delhi, India. This is the sequence of lectures that we are recording on case control studies in LMICs. This is the web page at the bottom of the slide uh, that takes you to the home page of this whole exercise. So, a bit about myself. I am a transport researcher. I do a wide variety of research on transportation. I have done quite a bit of work on looking at transportation's impact on public health through air pollution, traffic injuries, physical activity. Um, Traffic safety is one of my major area of research and interest. I also do a lot of work on bicycles, basically to try and understand bicycle usage and what interventions to put in place so that bicycle use can be increased in India and LMICs. It is actually to try and understand what were the risk factors for bicycle use in Indian cities that we started thinking about case control studies quite seriously, and we've done some work in the past couple of years, and the lecture this lecture uh, is basically based on a lot of experience that we have gathered while doing those studies, and that's what I'm going to talk about. So, the as the title suggests, I'm going to talk about data sources for traffic injuries and what are their limitations when you do case control studies. So, basically, this lecture will cover three main things. One is I will discuss uh, what are the limitations in police reported data, and police reported data is one of the most common data sources that researchers across the world have used for traffic injury epidemiology work. And I'm going to tell you what limitations there could be when you look at police data reported in LMICs. Next, I'm going to talk about hospital data. So, how does hospital data become useful for doing case control studies? And I will finish with giving you an example of a research question, of a brand new research question, something that I haven't worked on, uh, and uh, and the idea will be to help you go through this exercise of doing sample size calculations. Okay, so uh, underreporting of road crashes. Firstly, underreporting of road crashes by police is a global issue. All over the world, uh, police there is some level of underreporting in police reported data. So, for example, as a hypothetical case, if there are about 100 crashes taking place in a study area that you are interested in, then it is then they, these 100 crashes may have some minor injuries, some severe injuries. Severe injuries may mean, for example, the people who are injured may have to have hospitalization, for example, and they may also include some fatalities. So, underreporting means that if those 100 crashes are taking place, only about, let's say, 20 are being reported in the police. And many of those crashes do take place, but police does not record them and hence does not report them. So, and what we also know from a lot of empirical work done across the world is that this underreporting has differential bias. What this means is that the the underreporting is much higher for minor injuries, is slightly lower is slightly lower in severe injuries, and maybe the lowest level of underreporting happens in fatalities. So when somebody dies in a road death, it is much more likely that that crash is going to get reported by police. So let me give you an example. And by the way, the underreporting, as I said, happens all over the world, but the level of underreporting is much higher in LMIC, which makes it very challenging for us to do or to operationalize some of our road safety studies. So let me give you an example. So this is the data reported by London in England and Delhi in India. So in London in 2023, both the cities I'm talking about 2023, London reported about 26,000 injury crashes. So some level of injury had happened in all of these crashes, minor, severe. Of those 26,000, about 3,600 were seriously injured, 92 were fatal. So notice the relative ratios here. There is about 92 fatal and about more than 35 times that number is seriously injured, and about 260 times that number is all kinds of injuries. Now, if we look at similar data being reported by Delhi, Delhi is of course much more unsafe than London is, and hence reports much more number of fatalities. There are about 1,450 fatalities in 2023 and about 5,500 non-fatal injuries. This is how Delhi police classifies their data when they report it on in their annual reports. Now, I know because we have done this work, we have looked at this data in detail from Delhi, and we know that almost all of these non-fatal injuries that Delhi is reporting, 5470, almost all of them are severe injuries. So minor injuries are almost not reported in Delhi. And so you have already lost a huge chunk of your traffic injury cases simply because it's not being reported. And even if you look at the non-fatal injuries that we assume are all severe injuries, the ratio of the fatalities to non-fatal injuries is about 3. Now that number 3 is much lower than the number 36 that will be the approximate ratio of fatal to non-seriously injured in London. So look at this. In Delhi, that ratio is about 3 or 4, and in London, that ratio is about 35, 36. So just as a thumb rule, whenever you are given a data set, you are looking at it, if you want to make a very quick judgment about how well you think that data source is reporting all kinds of crashes, do this ratio calculation. And if you have hopefully have injuries classified by severity of those injuries, then you can see that the fatalities to severe injuries, that ratio will be about 35, and then fatalities to all injuries will be about 200 or so. So in LMICs, it is almost never the case that data is reported so well. But what does it mean for us? One very simple implication of this underreporting is that we have very few, we have a very small sample of cases to work with. So, that's what I'm going to talk about in this lecture going forward, the sample size calculation. So if you want to have enough number of cases in your data set to do a good statistical analysis, but your data source may not allow you to do so because it's a artificially small data set. The actual number of crashes taking place on the road is much higher. So sample size becomes very crucial. The other part is that you should keep in mind, depending on your context, it is very hard to tell though, that it is important for you to think about what are the determinants of underreporting. So if you think that many of the crashes that are happening in maybe minor roads, they are the ones who are not being reported, but on all major roads somehow police has more presence, people are there and they can see a crash, they report it to the police. For many reasons, the crashes that are taking place on major roads are being reported much better. So what this means is that in your data set that you have, there is a bias in in this particular parameter, which is major roads or minor roads. So if I were to use this data to try and understand what is the impact of the type of road on my fatality risk or injury risk, then this may create a lot of bias in my study. But if I am studying a risk factor which may not have anything to do with how underreporting happens in my city, then it may then you may claim that this sort of differential bias in underreporting may not be a problem for your study. So I want to quickly so I want to quickly uh, show you the sample size implication of this. So I don't. I'm sure that you may have seen this table in Professor Alex's lecture, and what this shows is that there are multiple parameters that we will have to use to do our sample size calculation, but there is one parameter that is in our control, and that is the number of controls that you will select in your study per case. So it could be one, it could be two, three, or four. And as you can see, that if you are in a situation where you do not have a much bigger data set or an adequate size of your data set to have enough sample size of cases, then one thing you could do is to increase this ratio of the number of controls to cases. So cases are the ones that are being, for example, reported by police as traffic crashes. Controls are the ones that are people who are not in the crashes. So controls uh, are many more in number, and if we have resources in place, time in and we have time, then we can actually increase the number of controls that we have in our data set. So you can see on the top row, the number of cases you need decreases from about 950 to 580. So this is one of the things we will look at towards the end of this lecture. But I wanted to give you a preview of of what implications and what things we need to keep in mind as if we have a small sample size of our cases in our data set. All right, so we discussed the one limitation in police reported data is underreporting, and it has, as we discussed, an implication on sample size calculations. The other problem with police reported data is how a lot of information that are crucial for us to describe a traffic crash uh, may be unavailable in such data. And for example, we often need what type of injuries did the victims have in a traffic crash, or what level of severity. So type of injuries may include whether there was a head injury, neck injury, shoulder injury, or something like this, or it may need classification by severity, whether it was a minor injury, severe injury. And because police is often not trained in reporting this information, or they may seem this information may not be important for them to record, the police records may not have this information. Also, police often doesn't report information on what's called road user behavior, whether the victims who were involved were wearing a seat belt if they were car occupants, whether they were wearing a helmet if they were motorcycle or bicycle users, or whether they were drunk, and how much blood alcohol level was there in their blood. So all of this information is often missing from police data. It may vary by some countries, but in India, for example, this information is almost never there. And as you can imagine, these are very important sets of information that one may need to do case control studies. For example, if I wanted to understand what is the impact of helmet use on the severity of head injuries for motorcycle users, then this information is important to me. And so so when you have decided a research question, you look for data sources. In your own setting, look at the police data, if that is something that is easily available to you, and see if that information is there. Also, we need to keep in mind that it is not about, suppose in about 100 crashes that you have from police, uh, about 10 of those crashes are reporting all of these values, and for other crashes this information is missing. Then you should treat that information as almost meaningless, because you don't know if the rest of the 90 cases, uh, whether it is missing because police did not report it, or it is missing because that wasn't that it just meant that it wasn't something that police thought was important. For example, if a motorcycle rider was wearing a helmet, then police did not think it was important for them to report. So, however, these two sets of information about the injuries and about the road users, both these sets of information can be easily gathered from a hospital setting, because hospital setting is a place where you you have the opportunity to talk to the patients who are coming into an emergency department. So when people walk into an emergency department, if you have your research associates or a doc or medical staff made responsible for this data collection, they will ask the person if you were involved in a traffic crash. The person will say yes, and if so, then they will record all the information that we just discussed. So, yes, I mean, early on, l- once you know what research question you are interested in, try and see your data sources soon, and see whether the data is available or not. And if not, then you have to find alternative ways to collect it. Okay, just since we are talking about hospitals, just a small caveat to keep in mind is the dual healthcare system that many of these countries have. So, for example, in India also, we have a dual system of public healthcare. Uh, One is public government hospitals, and another is private, which is run by private companies. So, and what happens in such a dual system of healthcare is that there may be some self selection of what type of patients would go to government run hospitals and what type of patients may go to private hospitals. Now, private hospitals are the ones where you have to pay a lot of money for your treatment. Public hospitals, you don't have to pay anything. So, again, just like we discussed in case of underreporting by police, how you have to keep in mind what is your understanding of how that underreporting happens, that differential underreporting happens. In case of police, I was giving you an example of how uh, injuries that are taking place on minor roads may be underreported. This is just my guess. But in case of hospitals, when you have private and public, it is possible that a lot of victims that go to uh, government hospitals may have lower socioeconomic status than the people who are going to private hospitals. So it is difficult for me to say what it would mean for a study that you are looking at, but if you think the risk factor that you are trying to study in your case control study may be linked strongly with the income level of the drivers or the vehicle owners, then uh, it is important for you to keep this in mind. And sometimes there's not much we can do about it. We still go ahead and do a study using whatever data is possible, but these are some of the these are some of the biases you need to keep in mind while you are making conclusions or inferences from your results. All right, so if you wanted to use hospital based data set for the reasons that I explained, that Sometimes a lot of variables that we are interested in are not available in police reported data. So you work with hospitals for it. Hospitals are the place where people will be recording details of type of injuries very well. They will also be recording injury severity very well. So, and depending on, there are two approaches to using hospital based data. One is the retrospective approach. In the retrospective approach, what you do is that you use all the data that has already been collected by the hospital. So suppose you were starting a study and you reach out to this surgeon in an emergency department in your city. You uh, say that this is the research question that you wanted to answer and you want to collaborate. Then the person may say, I have got this data set with me already. There's some sets of variables I'm already collecting. So why don't you see if you can use this data set? So this is the retrospective approach where the data has already been collected before you started the study. Now, the problem with retrospective approach could be that it still doesn't have all the variables that you are interested in. So, for example, the hospital, for some reason, were not collecting data on what were the road user type of the victims. For example, were they motorcycle user, car user, cycle user, something like this. They may not be collecting blood alcohol level in the patients that are coming to them because it is an expensive activity to do and something they do not do on a usual basis. So retrospective data set approach has that problem, but it is still it can be very useful in some places that maintain what's called a trauma registry. So trauma registry is a database of all the trauma cases that are coming to a hospital, and often the hospitals that set up such registries follow a protocol. There is a questionnaire with a set of questions that are that cover all aspects of, for example, of a traffic crash, and in such a form, in such a database, the variables that are important for you to describe a traffic crash are often there. So, but as would be true for any kind of data set, you should look at it, you should evaluate its quality before you decide you want to use it for your case control study. The other, what I should say, as the study design in which you have a lot of freedom to control the quality of data, the amount of data you want to collect, is the prospective study design, in which you set up your study and the data is collected from that point on. In such an approach, what you can do is you can have your research associates or hospital staff with a form which includes all the questions that you want to ask to the traffic injury victims that are coming to the hospital. And I know this is a lecture that is talking about traffic injuries, but if you are not interested in traffic injuries, if you're interested in falls, if you're interested in poisoning, many of those um, studies can also be done from a hospital setting. So, so prospective study design is something one could use, but as you can imagine, the amount of resources one may need, the amount of time one may need to conduct a prospective study design is something that you need to account for. And because it is you will have to have your own research staff doing this data collection, or the hospital staff who may need to get paid. Also, you, depending on your sample size, again coming back to the sample size, if your sample size is very big, and depending on the admissions that the hospital gets, this may take about 6 months, 7 months to have your enough sample size, then that is also a consideration that you should keep in mind when deciding to work with hospitals for your case control study. All right, so let's look at an example. Suppose we wanted to answer this research question: are motorcycles equipped with daytime running lights less likely to crash? So, if you're not aware of what a DRL feature is, A DRL is a feature in a motorcycle or in a car in which headlight comes on as soon as the engine is switched on. So, which means even if the driver uh, forgets about switching on the headlight will come on. The reason it is encouraged to do so is because motorcycles are small in size, and having a headlight on even during the day improves their visibility for other drivers. And the hypothesis would be that in having such a feature in your vehicle, you are less likely to be in a crash. And that's the research question we want to answer: whether that is indeed the case. So our exposure in terms of a case control study is daytime running lights. So, as I said, it improves the visibility of a motorcycle for other users. So, the cases that we define are the motorcycles that were involved in a crash with another vehicle during daytime. So, the crash is happening during daytime, and it is also happening is a multi-vehicle crash. So, it's not a single vehicle crash, which is also a very common occurrence with motorcycles. And controls are those motorcycles that were not involved in a crash but were also operating during daytime. All right. So now we are going to look at the sample size calculation if we wanted to do this study. Okay, so there are many open source websites and other software available for people to do sample size calculations. The one I would recommend to use is this website, OpenAPI. You can click on this website and you will see this box that is there on the slide. So there are 5 parameters that we need to input to do sample size calculation for any case control study. The top 2 parameters here, 95, the two-sided confidence interval and the power, you can assume them to be 95 and 80 respectively. So I would assume that these are the 2 parameters that we don't need to do anything with. The other parameter is ratio of controls to cases. So this is, as we discussed earlier, this is one of the parameters that we can control. So if we are left with a very small number of cases, we can boost our sample of controls, and in doing so, there will be the number of cases required for the study will become smaller and more manageable. So, and this value can go from 1 to 4. Beyond 4, it doesn't bring you a lot of benefit in terms of reduced sample size for cases. So we'll start with value 1. And the other next parameter we need to estimate is percent of controls exposed. So this is, in our example, this would mean what percentage of motorcycles that are being used during daytime have a daytime running light feature in their vehicle. So that is the definition of percentage of controls exposed for our research question, that the example we are looking at. So one way to estimate percentage of controls exposed in our example, and I'll say that again, in our case that would mean percentage of motorcycles being used during daytime that have DRL feature, would be to do an on-road observational survey. Now I will warn you that this is not the most ideal way to do this, but hear me out. So one way to do that would be that you go on different roads in your city, in the study area that you are looking at, and maybe look at a total observation about 100 motorcycles. Out of that, you will know which of those motorcycles had their headlight on. Now, those 2 numbers, the number of motorcycles with headlight on divided by the total observations you made, is that input that you need for sample size calculation. The warning would be that in doing such a calculation, you are assuming that every headlight on during daytime is because of DRL and not because driver chooses to do so. But often times the risk factor that you're looking at its prevalence may be known from other sources, other published literature, but sometimes that is not known, and it is one of those features that varies across the countries. Some countries have it prevalent quite a lot, some countries don't. So, for the risk factors that you know uh, are very peculiar to your own setting, you have to do that effort of collecting that data, of estimating that prevalence of exposure. And it seems like a quite a work to just do sample size, but please remember, the feasibility of doing a study successfully depends on your sample size. So I would put in the effort that may be needed to estimate this proportion. So, for example, let's assume that this percentage is about 60%. If you did a survey, so 0.6 is what you will input in that box in the sample size calculation. The other method could be that you don't do a survey. What you can do is, for example, let me tell you an example. Let me give you this example from India. So in India, starting April 2017 is when government mandated that all new motorcycles will have this ABS feature, sorry, DRL feature, daytime running lights. So what one could do to calculate the percentage of motorcycles that may have DRL is that they can get the number of motorcycles registered since 2017 to the point when they were doing the study, let's say 2025, and then divide that number by the total number of motorcycles existing in the study population. So this is again an approximation. So, but but it gives you some value, and you can use that either along with the observational survey, so that you have a range of values to look at. But the point I'm trying to make is that there's no one single method to estimate these prevalence of exposure that are needed for sample size calculation, and you should try various methods, maybe triangulate using multiple methods. So for the sake of this example, we'll assume that this proportion is about 65%. This is the number is right behind my face in the slide, but you will have access to PDF copy later. So the next in line is odds ratio of the risk factor that we are trying to study through our case control study. So this is another parameter that we need to input to do our sample size calculation. So what this means is that you need to have an idea of the effectiveness of the intervention that you are studying. Sometimes the intervention that you are studying may not have been studied at all, in which case you'll have to make some educated guess. You'll have to talk to experts about it. But daytime running lights, the example I'm using here, is a rather easy one. Well, partially easy. So we have a meta-analysis of all the studies that looked at the impact of daytime running lights on traffic crashes for cars. This meta-analysis was done by Professor Rune Elvik. So yes, the caveat here is that this estimate is for cars, and as you can see the underlined text, it says that multi-party daytime accidents, multi-party means there were more than one vehicle involved in the crash, those crashes were reduced by 10 to 15%. So expressing them as a proportion, this would be about 0.85 to 0.9. So if I were to express that percentage as odds ratio, this is how would I would express it. And this is a protective risk factor. Presence of a DRL improves the safety of a motorcycle. That's why the odds ratio value is less than 1. And because we are using this odds ratio for motorcycles, you may argue that a DR may have far more beneficial effect on a motorcycle, because motorcycles are smaller in size. They need more support of visibility than a car would, because cars are larger in size. During daytime they would rather be visible. So If I were to choose a value from 0.85 to zero point 0.9, I would use 0.85 for our exercise, because this is on the higher value of the effectiveness of DRL. So now we have got the three of the five parameters that we needed to input for our sample size. The other two parameters were the ones that I said you could use 95 and 80 respectively as default. Okay, so now we plug all those values in. So we have 95, 80 right on the top. Then ratio of controls to cases, as we discussed, we start with 1. Percentage of controls exposed, we are using 65. And odds ratio, we are using 0.85. So when you click on calculate, that you will see on that page, if you decide to use the web page I am suggesting, then you will see multiple methods of sample size calculation, but about 2500 cases. So now you look at the sample size of 2500 cases. You need to now look at the data set that you thought you are going to use. So for example, if I was using this for my study in Delhi, I know that I may not have 2500 cases of motorcycles involved in multi-party crashes and during daytime. So I may not have those cases, or I might have to use multiple years of data set to do this work. Then only will I have enough cases to do this study. But the problem in using a much longer time frame to do this study is that my assumption of percentage of controls exposed may also change. That number may reduce as we go back. For example, in 2024, 2023, it will be smaller. So what, as I suggested earlier, what you do is that you increase the ratio of controls to cases. So we started with 1, you can keep it to 3. And when we do so, we get a value of 1700. That number again is hidden right behind my face. You will see it in the PDF copy that we will share of this presentation. And as you would guess, the number of controls for those 1700 cases is 15100, because that's the ratio we are using. So, and remember, now you have 1700 cases from 2500. You may look at that number of cases and you will say, yes, this is manageable. The data source that I'm looking at has that number of cases. And please remember, you may use police reported crashes, or you may use hospital cases. If you are using hospital cases, it could be a retrospective approach where you are using the data that was already collected by the hospital. It could be a prospective approach, in which case your data collection will start with your study, but do an estimate of how long it will take for you to do this data collection, because that will depend on your resources and on the budget of your study. So this is the example that I wanted to give. So keep in mind, start with a research question, and once you start with a research question, try and figure out your sample size, your data sources, and it may not be a very simple exercise. You might have to go back and forth doing your sample size calculation and figuring out what data source you want to use. So, and controls, as you can imagine, are countless, so to say, because controls are the vehicles that are operating on the road. So you could go on the road and do observations of vehicles and record whether or not they have DRL. And this we might have to do for 5100 vehicles, motorcycles, during daytime if we were doing this study. Alright, so this is all I wanted to cover in my lecture. Thank you for your attention and good luck with your studies. If you have any questions, very specific questions for my lecture, you may send me an email on the emails listed at the title slide in this presentation, or you may send an email query to the to the email you have received from our team. uh, and there will be other examples that my other team members will discuss with you, so you will have lots to learn from. Thank you so much.